Today, we'll explain the process of IUD insertion, one of the most effective forms of long-term contraception. The intrauterine device, or IUD, is a small T-shaped device inserted into the uterus to prevent pregnancy. It works by releasing either copper or hormones to create an environment that is inhospitable to sperm. This method is highly reliable and can last anywhere from 3 to 10 years, depending on the type. We will walk you through the steps of the procedure, what to expect, and how it works to ensure you are fully informed. Before insertion, a healthcare provider will perform a pelvic exam to check the position and size of the uterus. The cervix is cleaned with an antiseptic solution to prevent infection. The next step is measuring the depth of the uterus using a thin instrument called a uterine sound. This ensures proper placement of the IUD. Now the IUD is carefully prepared for insertion. The medical professional ensures that everything is sterile and ready. The device is placed inside a thin tube called an inserter, which is designed to make the insertion process as smooth and painless as possible. This inserter is then gently guided through the cervix and into the uterus, ensuring minimal discomfort for the patient. Once the IUD is released from the inserter, it expands into its characteristic T shape, which helps it stay securely in place. The IUD then sits comfortably at the top of the uterus, where it can effectively prevent pregnancy. This small device can remain effective for several years, providing long-term contraception without the need for daily attention. The IUD has 2 small strings that extend through the cervix into the vagina. These strings are trimmed to ensure comfort and to allow for future removal. The IUD, or intrauterine device, is a small T-shaped device inserted into the uterus to prevent pregnancy. It works by preventing sperm from reaching and fertilizing an egg. There are 2 main types of IUDs: copper and hormonal. The copper IUD releases copper ions which are toxic to sperm, making it difficult for them to survive. On the other hand, the hormonal IUD releases progestin, a hormone that thickens cervical mucus to block sperm and also thins the uterine lining, making it less suitable for implantation. After insertion, it's normal to experience cramping or spotting. The healthcare provider may schedule a follow-up appointment to ensure the IUD is properly positioned. An IUD can remain effective for 3 to 10 years, depending on the type. It can be easily removed or replaced by a healthcare provider when needed. The IUD is a safe, highly effective form of birth control, offering long-term protection. For more information, talk to your healthcare provider. For more educational content, subscribe to our channel.